The purpose of this pig video is to demonstrate the use of the ResQGuard for the treatment of hemorrhagic shock. This pig, which weighs about 28 kilograms, is instrumented so that we can measure a variety of different parameters, including the aortic pressure, right atrial pressure, airway pressure, and intracranial pressure. In addition, we measure end-tidal CO2, heart rate, oxygen saturation, and carotid artery blood flow with a blood flow probe attached to the carotid artery. In the baseline state, the pig is breathing spontaneously and is anesthetized with a low dose of propofol. We'll look carefully now at the individual pressure measurements. First, focus on the Cosmo. The end-tidal CO2 in the baseline state is 44 millimeters of mercury. Oxygen saturation on room air is 98%. The respiratory rate is 33 times a minute, and the heart rate is 96 beats per minute. Looking now to the monitor, let's focus on the top tracing first, the ITP, or intrathoracic pressure. This is an airway pressure curve, and note that each time the pig inspires spontaneously, the airway pressure decreases to about minus 2.5 millimeters of mercury. The next tracing down in pink, labeled flow, is the carotid artery blood flow. Each time the heart contracts, blood flow increases to about 400 milliliters per minute. Below that is the aortic, or AO, pressure curve. Aortic pressures at this point in time are about 100 over 70 millimeters of mercury. Below that is ICP, or intracranial pressure. That varies a little bit with each ventilation, and the ICP is about 8 millimeters of mercury. And finally, below that is RA, or the right atrial pressure, which is varying between 0 and about 8 millimeters of mercury. Looking now at the lower monitor, we see that the blood flow to the brain is about 110 ml per minute based upon the carotid artery blood flow probe. The femoral artery is cannulated, and a pressure transducer called a malar pressure transducer is used to measure arterial pressures. All the pressure transducers are electronic microelectrodes. We'll begin the bleed by bleeding through the femoral artery. The blood is removed. 50% of the total blood volume in this pig will be removed over a total of 16 minutes. We remove it with a peristaltic pump to simulate an ongoing blood loss over 16 minutes. Then we'll turn off the pump and we'll wait about 5 minutes until the pig re-equilibrates, and then apply the ResQGuard to demonstrate its effect. During the course of this 16-minute bleed, approximately 900 cc's of blood will be removed. Over the course of the bleed, we'll observe the aortic pressure, which should decrease, the heart rate, which will increase, and the respiratory rate will also increase to try to compensate a little bit for the blood loss. Pigs and people increase their respiratory rate as well as their tidal volume and depth of respiration to try to naturally compensate for the loss of blood. We are now about halfway through the bleed. The aortic pressure is down to about 55 millimeters of mercury over about 40. The flow, peak flow to the brain, is down to about 300 ml per minute. The intrathoracic pressure varies between plus 2.5 and minus 2.5 millimeters of mercury. And the intracranial pressure and right atrial pressure also continue to decrease. As shown on the other monitors, the end-tidal CO2 is 39, oxygen saturation 100%, respiratory rate 34, and the heart rate is 137. Blood flow to the brain as measured by the carotid artery Doppler blood flow probe is about 70 milliliters per minute. At this point in time, the pig is receiving supplemental oxygen at 2 liters per minute, and about 700 milliliters have been withdrawn. We have now removed approximately 50% of the pig's blood volume and removed more than 900 milliliters of blood. At this point, the aortic pressure has decreased to 35 over 25 millimeters of mercury. Peak flow to the carotid is down to approximately 200 ml per minute. The intrathoracic pressure or airway pressure is 2.5 over minus 2.5 millimeters of mercury. Intracranial pressure is down to approximately 5 millimeters of mercury, and radiatrial pressure is between +1 and -2 millimeters of mercury. End-tidal CO2 is 35 millimeters of mercury, oxygen saturation 97, heart rate 210, respiratory rate approximately 30, and mean carotid artery blood flow 47 ml per minute. At this point in time, we will wait 5 minutes and then apply the ResQGuard. After 5 minutes of recovery, the systolic blood pressure is approximately 42 and the diastolic blood pressure approximately 30 millimeters of mercury. The intrathoracic pressure or airway pressure is varying between +2.5 and -2.5 millimeters of mercury. Maximum carotid artery blood flow is approximately 200 ml per minute, and the right atrial pressure and intracranial pressure are shown dipping below 0 millimeters of mercury with each inspiratory effort. 5 minutes into recovery, the carotid artery blood flow mean value is approximately 62 ml per minute, end-tidal CO2 36, oxygen saturation 96%, heart rate 207 beats per minute, and the respiratory rate is 26 times per minute. Tidal volume is approximately 177 to 180 ml. We'll now place the ResQGuard on the pig. With this setup, the ResQGuard is attached to an end-tidal CO2 detector for the Cosmos monitor, which is attached to a right angle to the endotracheal tube. Oxygen can easily be applied by connecting the oxygen tubing to the ResQGuard oxygen port as shown. As can be seen, with each inspiration now, the pig inspires to approximately -6 millimeters of mercury, and the blood pressure is already beginning to rise. We'll change the scale to show this again. As shown in green, when the ResQGuard is placed, the intrathoracic pressure, airway pressure decreases. As can be shown, it is decreased here to -6 millimeters of mercury with each inspiration. As shown in blue, upon starting treatment with the ResQGuard, the systolic blood pressure began to rise. It began at approximately 50 over 30 millimeters of mercury, and within less than 5 minutes, the systolic blood pressure begins to approach 60 millimeters of mercury. After approximately 8 minutes of ResQGuard treatment, all vital signs continue to improve. With each inspiration, the ITP, or intrathoracic pressure, is decreased to -7.5 millimeters of mercury. Peak carotid blood flow is approximately 250 ml per minute, and the systolic blood pressure is approximately 70, with a diastolic blood pressure of approximately 45 millimeters of mercury. Note that with each inspiratory effort, both the intracranial pressure and the right atrial pressure decrease. In this case, the intracranial pressure decreases from about 5 millimeters of mercury to about -2, and the right atrial pressure decreases from about 5 millimeters of mercury to about -8. This pig will remain hypotensive, but with reasonable perfusion to its heart and brain. In this way, we allow for permissive hypotension when treating this severity of blood loss in this pig model. The end-tidal CO2 is 41 millimeters of mercury, oxygen saturation 99%, respiratory rate is 28, heart rate 196, tidal volume is about 195 mLs, and the mean carotid blood flow is 80. 17 minutes after application of the ResQGuard, you can see that the systolic blood pressure is now stabilized. We began with a systolic blood pressure before the ResQGuard was placed at approximately 40 millimeters of mercury. At this point in time, the ResQGuard was placed. You can see that the intrathoracic pressure begins to lower, and simultaneously the aortic pressure rises. 17 minutes later, the aortic pressure is approximately 80 millimeters of mercury over approximately 45 millimeters of mercury. The airway pressure varies between 2.5 and approximately minus 7.5 millimeters of mercury. The peak systolic blood pressure remains at 80. The peak carotid blood flow is approximately 200 milliliters per minute. And seen here, the intracranial pressure and right atrial pressure in pink and black are approximately 5 over minus 5. On the Cosmos monitor, you can see that the end-tidal CO2 is 40, respiratory rate is 25, heart rate is 190 to 200, oxygen saturation 98%, tidal volume is approximately 180, and the mean carotid blood flow is approximately 79 to 80 milliliters per minute. The pig tolerated the ResQGuard treatment without difficulty. Respiratory rates range between 25 and 30 breaths per minute. Heart rate has stayed between 190 and 200 beats per minute, and the tidal volume has ranged between 180 and 200 cc's. It's important to note this pig received no fluid therapy. We did not return any blood, and it maintained its systolic blood pressure in this particular study for well over 30 minutes at 80 over 55 millimeters of mercury. In this way, the ResQGuard serves to buy time until more definitive therapy is applied in the setting of significant blood loss. We'll now summarize the effect of the ResQGuard from before and then 17 minutes after treatment. Heart rate went from 207 down to approximately 190 to 200 beats per minute. Respiratory rate stayed the same. It was 26 breaths per minute before and 25 to 30 breaths per minute afterwards. The airway pressure or intrathoracic pressure decreased from minus 2.5 to minus 7.5 millimeters of mercury with each inspiration. Systolic aortic pressure increased from 42 to 80 millimeters of mercury. Aortic diastolic pressures increased from 30 to 45 millimeters of mercury. Intracranial pressures decreased from about 5 over 0 millimeters of mercury to about 2 for systolic and minus 5 for diastolic. Right atrial pressure decreased from plus 2 over minus 2 millimeters of mercury before the device to from about 5 over minus 5 after the device. Peak carotid blood flow remained essentially unchanged at 200 ml per minute, whereas the mean carotid blood flow increased from 62 ml per minute to approximately 80 milliliters per minute. End-tidal CO2 increased from 35 to 40 millimeters of mercury. Oxygen saturation stayed the same at approximately 98%. Tidal volume increased from about 177 milliliters to approximately 190 milliliters.